Integrative medicine provides more options for patients looking for less invasive and non-intrusive treatments. Dr. Nina Nejme is with us today to explain. This is Daily Web TV. Dr. Nejme, you practice integrative medicine. What does that actually translate to for someone with a disease or a particular patient?
It just means that we have at our disposal different types of therapies that may include allopathic traditional medicine as well as complementary natural alternatives.
What types of conditions could I expect to be treated with here?
We treat anything from fertility to diabetes, cholesterol, high blood pressure, obesity, and even cancer.
Could you give me an example of the type of treatments that you would perform for perhaps somebody with diabetes?
For a diabetic, we look at the history of the diabetes. If someone is on insulin already or just oral medications, we try to minimize those medications and work on repairing the pancreas in hopes that that patient will not need any further anti-glycemic medications.
And how do you go about that?
Well, we give IV therapy, we have supplementation, we have alternatives to insulin even.
Really? Mm-hmm. That's very interesting. Now, if somebody wanted to continue with their traditional therapy, can you actually work with them?
Absolutely. It's always good to have a multiple disciplinary type of approach. We work with patients who are undergoing chemotherapy, for example, for their cancer, and we're still supporting their system here, or we can do the natural chemotherapy program all on our own here.
What could a patient expect if they're dealing with cancer when they're coming here and getting additional therapy with you?
In terms of any condition, specifically cancer, I should say, patients need more than just the medicine. They need more than the IV therapy or any therapy that you're going to offer. They need a lot of emotional support. They need education. They need to know what is happening to their body, and they need to feel that they're part of the therapy. This is not being done to them. They're part of that program.
So the patient really then becomes part of the decision-making in their treatment?
Yes, that is true.
Now, when it comes to infertility, which seems to be a growing problem these days, what can you do?
It's definitely on the incline. We've noticed that a lot of patients who have gone through IVF procedures or any type of invasive procedure and they still have not been able to conceive, they're turning to us to see if there's anything they can do to prepare their bodies for the IVF procedure. For example, acupuncture. And now it's standard in many, many hospitals to do acupuncture before the conceiving procedure.
Really? So that sounds like a perfect marriage.
Absolutely.
What other types of treatments would you do for somebody with infertility?
We have to harmonize their hormones, and we have to get their bodies healthy on every single level. A female's body will not get pregnant unless it's in top shape internally and externally.
Well, thank you so much for this great advice today, and it's awesome to know that people have alternatives to the traditional medicine.
My pleasure.
For more information on integrative medicine to deal with anything from fertility to cancer, please visit healthwisecenter.ca. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.